morning, everybody. Happy Monday, August 22nd. Going into our policy committee meeting. Hopefully everybody had a good weekend and your week is off to a good start. So good stuff, good stuff. Thank you guys for spending your Monday morning with us. First and foremost, can we get an approval of the agenda for today's policy committee meeting? All those in favor? Love it. All those opposed? None. Moving right along, public comment on agenda items. I did not see any cards. Did we get any cards, Christy?
No, I don't, and I'm not sure that they were put out today, so I would just defer to the group if there were public comments.
Okay, so more than happy. Anybody public comment on agenda items? More than happy to open that up for anybody. Okay. Seeing none, we will move right along. I will turn it over to Ms. Graham, our district attorney. Thank you.
Good morning. Thank you for having me. All right, if you will be patient with me, Ms. Smith is not able to be with us today, so I'm going to be running my own technology and presenting at the same time. We are going to start with policy BGD, and this is the board policy process and board review of administrative rules. And this policy was updated in 2019, but there is a new model policy with some language that we thought would be useful in adopting. And when we get to the administrative rule, there's some changes as well. So if everyone wants to take a moment to read through that.
And again, Chris, I just want to make sure this one is coming from the South Carolina School Board Association for a model policy?
Many of the updates are the model policy, yes.
Okay.
And I do want to point out here, it looks like we're striking the section about who can make recommendations to make a change to a policy, but that's actually included in this prior paragraph here. So it's not really being stricken, it's just moved around a bit. As well, we clarified when the two readings could be, because we had regular meetings in here and that had led to some confusion about whether that could be done at called board meetings or not. So just wanted to clarify that it requires two readings at board meetings.
And the only time I do think we've got, if something emergent came up, we of course as a whole board would have the option if we absolutely had to override the two readings.
So the way the policy is written, it does still require two readings. It would not have to come before policy committee first. It could just originate from the board, and that could be done at two called meetings. So if there were an emergency, we could have called meetings on consecutive days to resolve that. But the policy does require the two readings. There is a portion about suspension or repeal of a policy in an emergency situation, which is the first paragraph up there, that if there was an emergency that required suspension or repeal, that could be done, but the two readings for changes to a policy would have to go forward. Sorry, I don't know what's happening to that TV screen right there. It looks fine on this one, so. Any questions about this one?
No, I should know. Does it contradict anything? I know in the rule we're saying that it has to come through the policy committee. Mm-hmm. But like you just said, we don't necessarily have anything. I guess outside of that rule saying that it
Yes.
has to come through policy committee first?
It does not, and the rule itself really only talks about the policy committee meeting in terms of when the proposed changes will be posted to the community.
Okay.
Not
I see.
necessarily that it has to come before policy committee before it could move forward before the full board.
Got it.
We're just changing that when we go to the rule, which we certainly can go ahead and do that. It previously read that the changes wouldn't be made public until after first reading of the board, but we have changed that so that it would happen after policy committee.
Perfect. And in the rare circumstance of policy, I guess, went to first reading without coming through the committee, which is a possibility. Again, I think that would be rare.
Right.
Do we need anything in here saying that we would also make that available?
We could certainly add that. I think because it would have gone through first reading, it would be available, practically speaking. But if the committee would like to add that language specifically to clarify, we can do that.
You guys see what I'm kind of saying there? Yeah, and I don't know if you just put where we lined out the first reading. I don't know if you say something and or the board's first reading, if that makes sense.
Yes, I can certainly make that change. Are we okay with the policy itself and we can move to the rule?
You guys okay with that policy? I didn't see anything really standing out. It's just basically saying we can take policy recommendations from anybody.
Yes.
Yep.
And the administrative rule does have a couple of changes here. It had stated that recommendations would be given to the board 30 days prior to approval. But for practical reasons, unfortunately, that doesn't always happen. So we were proposing to change that to as soon as reasonably possible so that the board would have an opportunity to review that. Like we discussed, we changed the time that those changes would be made available to the public to be after the policy committee review or after first reading if there is no policy committee review. And then another change to this is that we are removing the requirement that the schools maintain a hard copy of the book, of the manual. I'm sorry, I don't know what's happening with that. Yeah, I don't know if we can turn that off, but that the schools have been required to maintain a hard copy of the manual, and every time there's an update to a policy, we have to email that out to the school, and someone has to print it out and add it to the manual. And since it's available online and everybody now has access to their devices, we thought that that was a much cleaner way to handle that and moving us forward into 2022 without having those paper copies that risk that someone forgets to print out an update and add it to those paper copies.
Hey, Christy, on the bottom, when it talks about the requirement of 2 readings at meetings or work sessions,
Yes.
is a work session a meeting?
That's a great question. That's from the model policy. I think it would be fine if we remove work sessions. I'm not really sure what that's intended to mean because obviously if we were a workshop, there wouldn't be any action, so it couldn't be approved there. So it really has to mean a board meeting, but that's the model language, but certainly we can remove that if that's the committee's wish.
I mean, I think you could go either way. I guess I could see where if it were noticed correctly and if there were potential actions that could be taken from that. Because, I mean, in theory, when the board meets and we have a quorum of the board, as long as we denote that there could be some actionable item coming out of that meeting, whether it be a work session, workshop, whatever it is, then I think we would be okay. My only concern would be if we take that out, is it really ever going to be an issue? Probably not, but we may limit ourselves if someone really wanted to kind of needle that, I guess.
And that is why we take out the word regular there to clarify that it could be a called board meeting. I think that even if we took out work sessions, if it just said 2 meetings,
Yeah.
I think that could be
That's true.
any type of meeting.
Because a
of the board.
workshop is a meeting. I mean, yeah, a work session is a meeting, sure.
I don't think it, I think by taking
Yeah,
it out,
you-
it doesn't limit us necessarily.
Yeah, I think that's fine. So let's take out that work sessions.
Okay. Any questions or concerns in regard to the administrative rule?
No, I think it's good. Saving trees.
That's right.
Saving trees. I remember when I first came onto the board, and remember that, Mr. Mitchum? Every single one of us had the board policy manual,
Yes.
and they're that thick. And then
Like
every
600
time we
pages.
updated it, someone would have to come in and change out all those sheets, and yeah,
Mm-hmm.
that was a lot.
All right, next up, we have policy EBCB, which is
Hold-
safety
hold on one
drills.
second.
Sorry,
Oh,
I'm
sure.
sorry. Can we go back on the policy again? Sorry.
Uh-huh.
Does the board not have to approve all of the administrative rules?
Technically speaking, no. By practice, Dorchester 2 has always brought those before the board, but the purpose of the administrative rules are to provide context and depth to the board policy. So really, the board provides the board policy, and the district provides the administrative rules. By practice, we have always brought those before the board and continue to do that. But that is the intent of an administrative rule, is actually to be developed by the administration.
Okay. In the back of the policy, right down here.
Any other questions or concerns on BGD?
I'm good. Everybody good? Moving right along.
Okay. We will move on to EBCB, which is in regard to our safety drills. This is an update to a rather outdated policy from 2002 to bring the district into compliance with Act 256, as well as several other state statutes that have passed in the previous years in regard to the number of safety drills that we should have, as well as inspections of our firewalls, inspections of our buildings to ensure that they are in compliance with fire code. So this is based on the model policy, bringing us into compliance with that.
I did want to ask the fire drills, earthquake, tornado, all that sort of stuff. I think everybody's kind of used to those, of course, and I see Mr. Jayat out there. Thank you for being here this morning. Just talking a little bit, so the active shooter drills, can we talk just a little bit about that? What do those look like now, or are those announced? I'm assuming we keep some of that in our back pocket for security reasons.
Correct.
Yeah.
So the state only requires 1 per semester. In our district, we do 1 per quarter, plus 1 in the first 30 days. So we do a total of 5 active shooter or lockdown drills. Generally speaking, we announce those at least to the teachers, because when you go on a lockdown, we want them, in a normal lockdown, if it was an emergency situation, if they had information, they would call 911 as well. So in order to avoid any confusion or misuse of emergency resources, we do announce those to the teachers. And then we also have a statement ready that as soon as we initiate a lockdown drill, we send a statement out to the school community as well, so that they know, parents know, if they get a text from their kid that we're in lockdown, that we're in a drill. So the parents get that notification as well.
Got it. Thank you. yeah, I think for all of us, and certainly don't, I know all the other board members, I would never speak for anybody else, but safety and security, 1,000% paramount for the district. So thank you for all you do. Any other questions on the drills? It is a shame, the world we live in, that we even have to have that in there, but here we are.
So we took out just the verbiage tornado, that just severe weather just kind of includes everything, is that
Yes.
the idea behind
Yes,
that?
that was to clarify several different severe weather situations.
Any severe
not
weather,
just
right,
tornadoes.
right, yes, okay.
What, maybe just a little bit, I do see that last piece that we added, the classroom and hallway safety
Yes.
item. What is that pertaining to?
That is in compliance with Act 256 and the fire code in terms of how much of the walls can be covered with paper, what types of home goods can be used in your classroom. Mr. Souls can certainly provide more detail on that if you want, but there are a lot of restrictions on using outside furniture, outside rugs, curtains, and how much of your classroom wall, how much of the hallway walls can be covered with paper. So it's just reminding everybody that we will inform our staff of those requirements so that they can enforce those in their classroom.
I'm sorry, I had an appointment and couldn't get here in time, but on the safety EBCB, I guess that's what we're discussing.
Yes.
The first fire drill, I mean, it's on the second page, but you have that it is without notice. Is that for the first fire drill, or is that every fire drill that you scratched out without notice?
I will defer to Mr. Jayed on that if that's all right.
So again, with the fire drills, we do one every month as required by the state, and then we also do one in the first 10 days of school. We generally announce the first one so that we can go through the procedures, go through the plans, and all those types of things. And then we do have, they do require at least one unannounced fire drill per year. We generally kind of mix it up. We allow the schools to decide if they're going to announce it or not announce it. We generally, after the first one and maybe the second one at elementary schools, to really go over with those kids again, hey, this is what we're going to do, this is where we're going to go. We prefer for them to be unannounced so that teachers and students can react as they normally would in a fire. Now, that is definitely different than active shooter and lockdown drills, where we let the teachers know beforehand that we're going to do that so there's no confusion. With fire drills, it's a little bit different because we're just trying to get everybody out efficiently and effectively. So then we just let them know once they get out there that, hey, this was a drill, you can come on back in.
Well, I'm glad that you can do it without notice, because when I taught, if the kids knew, they didn't try to get out. It's like, oh, we're going to have a fire drill, and they took their time. So that's a safety issue, big time. So
Yes.
you do the first one for sure with
notice.
notice, and that's good, especially for our younger. And then from then on, you can decide.
The school can decide, the school safety officer and the principal generally talk and decide whether they want to do it announced or unannounced. And sometimes that just depends on maybe if they had issues in the last one, you know, kids were in the hallway or in the bathroom and we didn't account for them quickly enough. Maybe they'll go over those procedures and say, hey, we're going to do another one. This is what we want to do next time. So
Okay.
it's kind of up to them to decide.
Thank you.
Yes, ma'am.
Thank you.
All good? Ms. Robinson, all good? Mr. Mitchum? Moving right along.
Excellent. Okay, next up is IJOA, which is our field trip policy. And I do want to clarify that there is an administrative rule that goes with this policy that provides more detail, and that will come before the board at the next policy committee meeting. I apologize, it was supposed to come with this one, but unfortunately it didn't make the agenda, and so in the interest of FOIA, we will not discuss that today, but I do want everybody to know that there is an administrative rule that accompanies this policy with more detail and information, and that will come before the board at the next policy meeting. And again, these are just some updates to our current policy based on the model policy, as well as changing a few timelines to allow schools and the district more time to evaluate the appropriateness of a field trip.
Can I ask, when there is a cost to the field trip, how is that handled?
So that's actually covered in the administrative rule. We have maximums that a field trip can cost for a day trip or for an overnight trip. And that's one of the things that the district is currently looking at, is whether those maximums should remain the same or be increased, because that policy hasn't been looked at in quite some time. But generally there is a maximum amount that students can be asked to pay out of pocket, and then they are expected to fundraise to be able to fund the rest of the trip, usually as a team, as a group, as a class. They conduct that fundraiser, and then those funds are spread evenly among all the students going on the trip to reduce the cost to get it below the amounts.
Well, I know that's how the old policy was. So those who may, at no fault of their own, have the funds,
Right.
then there's an opportunity for them to do a fundraiser, and it's distributed, everybody who actually participates in the fundraiser.
I believe, yes, everybody in the group, it would be distributed among them to get the cost down. So the administrative rule states, I want to say that it's $75 for a day trip and $250 for an overnight trip are the maximum out-of-pocket costs that anybody could have to incur. And so if they are able, they use those fundraisers to get it down below that cost for everybody. But if there was a student who is not able to afford those amounts, they could work with the administration to use the fundraiser to supplement that, or school funds, something like that.
Okay, that's good, thanks.
So for day field trips, it's approved by the principal, and for overnight, it's the principal and the district?
Yes.
Yeah, I think the rule, probably be some more discussion with the rule when that, because I do remember a few years ago that came up with the costs.
Yes, there are some significant changes anticipated to the rule, so that will come before the board at the next policy committee meeting.
Okay. Well, I think one is separate. This is separate from the rule. And I don't see anything in here that would necessarily warrant us waiting on this piece of it. Is that right, Ms. Graham?
Yes, that would be fine, whichever way the committee wishes to do it. But they're not inherently tied to one another in that way, so we could move forward with this one and then do the rule at the next policy committee meeting.
Love it. Everybody good?
All right, next up we have JLCD, which is our Assisting Students with Medications policy. And this one just has a few minor changes which were suggested by our nursing director and staff to bring it up to date.
Again, it's a little bit unfortunate this comes up from time to time in email. I just want to maybe put a little bit on the record, Nurse Santa Maria. There is never a time in our schools when a nurse would ever give a medication, an injection, a vaccine, anything medically initiated without full 100% authenticated sign-off from both a parent and a medical professional. Is that correct?
That's correct. We don't have an order to even give a cough drop or Neosporin. The only exception to that is epinephrine. There's a state law in place with a standing order from a physician. So if someone was having an anaphylactic, life-threatening emergency, we could administer our school stock EpiPens to them without a specific order from their physician because we have a standing state order, but that's the only exception.
AEDs, life-saving
So that would be for,
techniques.
right, that would be for the EpiPens that we have stocked at the school, and then certainly if someone was having a cardiac emergency, we could deploy the AED, yes.
Got it. Thank you. All good. No, it doesn't look really like any change. Just the availability of those forms,
Yes, adding
where
that
those are at the
available on
district
website.
the district website.
And
yeah.
then clarifying physician for healthcare provider. And also striking out including aspirin at the top. We just don't see a need for an example in that situation. So.
So this doesn't really address this, but is a student allowed to administer an over-the-counter medication to themselves?
I'll let Ms. Santa Maria answer that.
Yes, but they do have to have an order for that. There's a separate order form for students to self-monitor, self-administer, self-carry their own medication, and that applies to over-the-counter medications as well. So if they'd like to carry their own, vitamins or aspirin or anything in school, they need to have an order for that to allow them to carry it.
From a healthcare provider?
Yes, and their parent.
Gotcha.
Yeah, I think we double lined out.
Yes, on the administrative
rule.
rule. I was just seeing that as well. If we're ready to move to the administrative rule, I will pull that up.
Is everybody good with the
But I do see
policy
that. I think it should
itself?
be medications to align with the policy. Just a typo in there, but it would be medications. Okay. So if we are ready to move to
Good
the
catch.
administrative rule on this one, again, just making some minor changes that bring it up to date with our practices and procedures, as well as some of the state statutes that have changed in regard to requiring a physician signature versus a nurse practitioner or a physician's assistant.
I do have just a question, and it's just because I want to completely understand, and I'm sure it's just me, but when you say assisting with medication does not include administration of injectable medications, what if they're diabetic or something and a child cannot do it himself, herself?
Sure. So the law in South Carolina delineates between assisting with medications and administering them. And when you're delegating that task to a non-nursing professional, you have to be very careful which language you use. Assisting with a medication means simply that you are opening a pill bottle, or opening a container, handing it to an individual, ensuring that they took it and documenting it. Administering it actually means that you are going through the process of determining that they need it, that you're checking what they need it for, and then that also covers injectable medications like insulin or other things. So there's
So
certain things that can be
assisting and
delegated.
administrating are completely, okay.
Yes. Mhm.
Thank you.
You're welcome.
So is there a different policy for administrating? Is that what you're saying, or no?
So we just clarified the language in here for all of the portions that talk about delegating those tasks to an unlicensed individual. Since they are only able to assist with medications, they can't administer them. So when it talks about a principal's designee or someone who's not licensed, then we added the language to include this with. There's certain medications that can be administered by an unlicensed personnel, but those are only emergency medications, not routine. So EpiPens and things like that would fall under that category. So they can do both, but there's very specific times when they can.
And on the, if you turn the page, it shows that.
Christie, I noticed that we struck out the sentence, "The principal or his or her designee will keep a record of all instances when the student is assisted with medication." Does this mean we're not keeping records?
I'll defer to Ms. Santa Maria, but I believe the nurses keep that rather than the principal.
I'm just looking at it to make sure I say the right thing. Yes, so we.
Oh, I read it. It was already duplicated, it looks
Yeah.
like. Thank you.
Well, I like that you even have who qualifies as an assistant. That, I think that's really good, especially for parents to know.
Do we, just in general, so when we do our beginning of the year stuff, does this information all go out? How do we disseminate this information to students who might need medications or that sort of information?
So all of the information is on the district website year-round, and then it's also published in the district parent-student handbook. There's a whole health services section that outlines exactly all the medication policies and procedures, but it is on also all the forms that go out to providers. It outlines which forms are for what and what signatures are needed to be able to self-carry versus leave medicine in the nurse's office.
And we do have an RN in every school?
Yes, we have a registered nurse that works full-time, at least one in every school, and then we have LPNs, licensed practical nurses, that float throughout the district.
That's great.
That screen, for you guys can't see it, but that screen, I keep looking down, I think like somebody's scrolling super fast.
Yeah, and I apologize because I don't know how to turn that one off without also turning this one off, so.
That's okay.
All good.
I'm sure there's a way, but.
Hopefully our, I don't know, the live stream, are we showing the screen? Okay. Hopefully we're not showing that one. Any other questions on the rule or policy? All good? Thank you, Nurse Santa Maria. Good stuff.
I'll ask her not to go too far because the rest of ours are nursing-related policies as well. So next up, we have JLCDE, which is the exhibit, which goes with this policy and administrative rule. We're recommending deletion of this, not because we no longer use it, but it's already included in the permission slip that is signed by parents in order for students to be administered medication or self-administer their medication, and it's not really appropriate for board policy.
Yep, that's easy. Moving right along.
Excellent. Next up, we have JLCDA, which is individual health care plans. And again, there are just some minor changes here to bring this policy up to date with the best practices and procedures.
Who typically, for those, the IHPs, who's typically involved? Obviously, the healthcare provider, the parent, but at a school level, I know we've got IGPs and all sorts of different plans. Who actually sits down at the table to create these?
So the nurses create them. They're meant to capture just the medical care of the student. So if that care extends beyond just the clinic, then that's when we get into maybe a 504 and certainly an emergency action plan that gets shared out with teachers and other staff. But IHPs are created by the nurse at the direction of doctors and parents once we receive those medication orders or treatment orders.
Do we, I see the wording there, when we're self-administering medication should have an up-to-date. Does that need to be will have an up-to-date IHP?
We could certainly change that language, yes, to make it more clear.
I think that's just good for us too, and the parent.
Okay, we'll make that change.
Yeah, it's probably, I don't know of many instances in policy where we should use the word should.
Yes.
Is everybody good on the actual policy there for IHPs? And then I think we've got the rule, the accompanying rule for those next.
Yes, we do. And there are not actually any recommended changes to this. But as the district moves forward, when we review a policy, we are asking that the policy committee go ahead and review that so that we can notate it and help keep us up to date with our policies. So this is one where we are asking that we just renew it as it is, but with a review.
It looks good to me.
Any changes to this
It does to all.
Of course, all the questions
I
we just
apologize.
asked are
Miss-
now in the rule.
Ms. Santamaria is telling me that this one is supposed to have changes. I apologize for that. So if we could strike this one and we will move it to the next policy committee meeting.
Well, the only question I even have about it, and I know everybody's on top, I know you are on top of things, but when possible, an IHP should be ready for implementation on the first day the student will attend or within a reasonable time. What constitutes a reasonable time? 10 days, 30 days?
It really depends on the situation and the complexity of the plan itself. For students who are returning to our district with the same healthcare needs that they had the year prior, the nurses work on those plans in the spring so that they are ready for the first day of school. It's really for newly enrolled students who are entering the district for the first time or have new medical concerns where those plans have to be created. And at times, unfortunately, we might find out on online registration that a student has a medical concern, but it could take several weeks before we actually get the paperwork or the orders from a physician or healthcare provider. So we don't usually put a specific timeline on it, but once the nurses get that information, they get the ball rolling right away to get those plans in place.
And so the district is not held accountable if we don't have that information should something go wrong with that student?
Yes and no. We do get audited annually regarding our IHPs, and that typically happens in the spring. And so we are well past the point where a student has newly entered the district and a plan is always in place by that point. But I think I can recall any instance where a student should have had a plan and we waited until the last minute to get one done. They typically, as soon as we get those orders in, especially since we don't need any additional documentation, once a student has orders in place, we can create one right away. So.
Okay, thank you.
And as I said, we'll present that at the next policy meeting with the changes. I apologize for that.
Just something that came to mind. So allergies, that type of thing, does that fall under the IHP? If someone came in and said, I have a peanut allergy?
Yes, so IHPs have to be created for specific criteria per the Department of Ed, and those are some of the criteria. One of the changes was to update them, but it's anytime they're medically fragile, have treatment that can prevent death or disability on an emergent basis, so that's where the food allergies and seizure disorders and things come into play, asthma, other conditions like that fall in. They usually meet multiple criteria, not just one.
Got it. Thank you. Of course, the 2 policies from now talks about food allergies.
It's good to have them updated, though.
Okay.
Are these just for review as well?
One of them, I think JLCDB, does have one minor change, which has escaped me twice now, but it's just the addition of the word "to" right here.
Mm-hmm.
And otherwise for review, but technically it would be marked as a change.
With the EpiPens, is everyone in the building trained on the use and location of EpiPens?
So annually, the staff is provided with information about the location of the stock EpiPens. Typically, at a minimum, the school's crisis management team, which would be that same group of individuals who's trained in the use of the AED, gets information on specifically how to use it. And then as the school year goes on, as field trips are taking place and students are leaving campus, groups of teachers who might be leaving campus with a student who has a food allergy that requires an EpiPen or another allergy gets specific training in its use. We're moving more towards a model of providing school-wide training, but because of COVID, that became a little more challenging. We weren't meeting in groups, so we're moving towards that in the future to try to get everyone in the building trained on the use of EpiPens.
Thank you. Do we maintain those in the district office as well?
I'm sorry, say that again.
Do we maintain EpiPens in the district office as well?
We don't. The provider that issues them out to schools will only issue them to a school location. They will not issue them to district buildings that don't actually house students. It's just part of the way the law is written. They're provided for free through Mylan, which is the manufacturer of the actual brand name epinephrine, and they will only provide them to locations that actually house students because they interpret the law to mean that they're for use in schools only.
So does a bus constitute a building that the students are in?
It doesn't, and that would be a little tricky anyway because it wouldn't abide by our board policies for storage of medications. They have to be under a double lock system. Even the stock EpiPens are locked in a cabinet and then locked in the school, so we don't typically stock any medications on our buses.
You don't have a first aid you do have first aids on buses, right?
Yes, but
Okay.
transportation has first aid kits, but we don't provide any medication in them.
Okay.
Yeah, it's interesting that we do the buses I can understand because that's a little more difficult, but at the district office, I'm surprised. What the cost of those is pretty exorbitant?
They're about $600 each, yeah. If you're not going through insurance, which for stock purposes, you're not they're not student-specific or individual-specific.
So if a child is on a bus and has an allergic attack, something, does the bus, Mr. Shope's not here, do they just pull over and call EMS? Is that?
Yes, so buses that just have a driver and no monitor, their procedure for any medical emergency is to pull the bus over, make sure that everyone on board is safe, and then they initiate their process through dispatch to engage with EMS services to come out to the bus. We do have some students who carry their own medication and they're on buses that have a monitor, and that monitor and driver are trained in the administration of that medication.
That's good to know because there's thousands on a bus at any given dismissal. So thank you for.
Everybody good with EpiPens? Moving right along.
Excellent. And the last one that we have for review today is JLCDC, which is food allergies. And again, there are not recommended changes to this one, but something that does affect a good number of our students. So we just wanted to make sure that we reviewed it in a timely manner.
Everybody good with the review of the food allergies? I do think it's good that we've got the blurb in there about the food allergy bullying at the end. Unfortunately, it's kids will be kids, so I think it's appropriate that we've got that in policy. Everybody good on those policies? So we are moving the rule, correct? The JLCDA rule
Yes.
to the next one. Okay. Anything else? Everybody good? Questions, comments, concerns, policies for today? All good stuff? Okay. It's always eye-opening because sometimes you just think we just have to teach them reading, writing, and arithmetic. There's just a little bit more to it. Just a little bit more to it. I will now open the floor to public comment for our policy committee. Public comments for policy committee. Anybody? I don't see anybody rushing up to the microphone, so I'm going to assume no public comment. With that said, would anybody like to make a motion to adjourn? So moved. I have a first and a second. Any discussion? Love it. We will adjourn. We'll see everybody tonight, 6 p.m. Have a great day. Thank you.